Welcome, participants. Thank you for joining us today. We're just opening up and we're allowing for a few people to come on, and we'll get started soon with our panel. While we're waiting, tell me a little something about yourself in the chat, where you're from, how you're feeling today. Are you excited for fall? Are you all things pumpkin spice? Anything you want, I want to know. I'm all about pumpkin spice except for pumpkin spice cheese. I saw Trader Joe's had pumpkin spice cheese. That's a little too much for me. We'll get started here. Hello, my name is Tamika Felder and I will serve as your moderator today. You are joining into our webinar discussing the women's health hosted by the Texas Oncology Foundation and presenting sponsor, Texas Oncology. I am Tamika Felder. I am a 19-year cervical cancer survivor. And, I am thrilled to be moderating this panel and sharing my experience as a patient and a patient advocate. I am passionate about women's health as someone who had to have a radical hysterectomy, followed by chemotherapy and radiation therapy at 25. I am glad that I survived it. I also know firsthand that getting to no evidence of disease is just one part of it. It's living the life beyond cancer that's the other part of it. And so the one thing we want to do here, we want to help you not only survive, we want to help you thrive in your survivorship. For those of you who are still in treatment and going through it, we want to be there for support. We are a community. This community is filled with so much information. I implore you to go and look at the Texas Oncology Foundation's website and get familiar with them and acclimated. We want to take time to recognize the Texas Oncology for their generous sponsorship of our Survive and Thrive webinar series. I don't know about you, but it has really helped during this time of quarantine and uncertainty. We are thankful for their partnership and their support, that we're able to continue providing free educational sessions for the community. I want to shout out the Texas Oncology Foundation. They are such a beacon in this community. They provide support to cancer patients in the community where they live, work, and receive treatment, which we all know, especially those of us who've had to travel the distance for treatment. It's so very important. Through Survive and Thrive programming, the foundation is able to provide educational events and resources to both help build community connections and support all involved in the cancer journey. A little housekeeping as we get started. So we cannot see or hear you. You can see and hear us, but the way that we'll communicate is in the chat. I'm a chat girl. I'm always checking the chat, so be sure to utilize that chat option. If you're on Facebook, you can also share on the chat on Facebook. Believe it or not, I'll be checking there too. We've also got Kelly Condon with the foundation. You can't see or hear her, but many of you probably know her name. She's there. We want to thank our founder, Natalie O'Rourke, who's so dedicated and passionate to the work that we do at the foundation. So I want to take a moment and introduce our wonderful panelists. We are going to ask them to quickly introduce themselves and also let us know if they're ready for fall, if they're looking forward to anything and everything pumpkin spice. So we'll start with Dr. Jennifer Hecht, and we also have Katie Ozuna. Thank you both for joining us.
Hello, everyone. My name is Jennifer Hecht. I am a breast surgeon with Texas Oncology. I'm in Southwest Fort Worth. A little bit about me. I am originally from Oklahoma and moved here to take my job with Texas Oncology, and I love it. I do love fall, but I think that Texas is kind of slow to catch on to the whole fall weather thing, so I'm eagerly anticipating that. But I specialize obviously in breast cancer, but I take care of people's benign breast issues as well. It's not just a female disease. I take care of males with breast cancer and males with other benign breast issues as well. But thank you all for asking me to participate, and I'm excited to visit with you all.
And good morning,
Thank you so much.
Good morning, everyone. I'm Katie Ozuna. I'm an oncology social worker, a survivorship navigator, and also a young adult caregiver to my husband, Justin. Man, I love fall. I agree. It is always way too hot here in Texas in the fall. I am in the minority with pumpkin spice. I do not like it. I have never liked pumpkin. My dad doesn't either, so I blame him. But I do love fall movies. I love hot chocolate. I love anytime it's below 60, I have a fire in the fireplace, even if it's way too hot outside. So I love all of those fall things.
Katie, thank you for being in your truth. I love it.
Don't
So,
put me off the panel because I don't like pumpkin spice.
absolutely not. So we had a little trouble connecting to Facebook. And so I want to say hi to everyone who is joining us on Facebook. You didn't really miss much except for our awesome panel introducing themselves, but you'll be able to catch the top half of it on the replay. So we are going to jump right into this. Women's health. A lot of times women, we are the ones who are the glue. We're the ones who hold things together in our community. We have to remind ourselves that, like they tell you on the plane, put your oxygen mask on first before anyone else. And so when we start talking about cancer and how it impacts women, October is Breast Cancer Awareness Month, a cancer that we really do need to focus on. you know, Lots of people are diagnosed with breast cancer, but we also have to also shine a light on other cancers, whether it be above the belt or below the belt. So, Dr. Hecht, can you please talk about the different types of cancers that impact women, and the signs and symptoms that they should be aware of, and steps of precautions that need to be practiced?
Of course, yeah. So, I mean, obviously, like you mentioned, with October, breast cancer awareness and is on everybody's mind because October, you hear it. It's pink everywhere. Check your breasts, make sure you're getting your mammograms. But other cancers that women are affected by, there's cervical, there's ovarian, uterine, vaginal, vulvar, endometrial cancers, and those are all important women cancers to be educated about. As far as signs and symptoms, I think that, often women are encouraged to do breast exams on themselves. I encourage my patients to do that. Just make sure that you're checking your breasts once a month, typically after your periods if you're having them. As far as other cancers, I think that just listening to your body and being aware of the symptoms that you're feeling, sometimes with some of the ovarian or cervical cancers, endometrial cancers, uterine cancers, people will have abdominal fullness, or they'll have abnormal bleeding or an abnormal discharge. And all of those things are symptoms that can alert you to something maybe that's going on that you may not be aware of. And so I think that keeping up with your annual exams, making sure that you're going to your gynecologist and getting checked out, but then for sure, just bringing light to those symptoms that you may be experiencing so that it can be looked at and worked up if you're having any of those types of problems.
Thank you so much. As we're talking about those things, could you also talk about healthcare disparities as it pertains to people in the Black or Hispanic communities, and just what do we need to know? How do we need to proact? How do we also need to spread awareness to others to make sure that we are being proactive with screenings? I know I wasn't being proactive with my screening. And now I'm very passionate about telling everyone, like, I've never met anyone who wakes up and say, oh my goodness, it's PAP day. I'm so excited to go get a PAP. But it's just definitely one of those things that you have to do. So what do we need to know to make sure that people don't fall in the crack when it comes to health disparities?
I mean, I think that things like this obviously help, where people are being exposed to the types of screenings that they should get, and just being more educated. I think we see it all the time. There are disparities in people keeping up with their screenings and even diagnoses of cancer. And I wish that I had a good, this will fix the problem. I think that, just as women, like you mentioned, we're always taking care of everyone else. And so if there's people out there that are seeing this today and you don't realize, oh my gosh, starting at 40, I needed to get a mammogram. If you just tell your family and your friends, and hopefully that those disparities, we can continue trying to educate people about when they need to be getting these screenings. And I I really do wish that I had a way to fix all of that, because I see it. I see people who didn't realize, oh my gosh, I should have been getting a pap smear, and then maybe I would have caught this much earlier. And so I think that I don't know what the answer is. Maybe a better health class in schools or something, but I think that, us as women, when you find out these things and you're educated about when to get your screenings, if you just tell 2 or 3 people and they tell 2 or 3 people, hopefully that chain effect will come into play, and maybe we can decrease the disparities that are often seen.
And so I also want to spend some time talking about young adults. I was 25, and also I'd like to really talk about our LGBTQ patients who may not necessarily be at a higher risk, but who may not be going to get screened because of various reasons, from feeling misunderstood, feeling unwelcomed, and how do we make sure that, I know it's no magic message for everyone, but how do we cast that net to try to help as many people as possible?
Sure. So I'm used to saying, I'm not used to video calls. I'm used to saying, this is Katie. So yes, this is Katie. As a social worker, I see this a lot. The LGBTQIA plus community. There are lots of disparities because of real or perceived discrimination by their healthcare provider, a member of their staff, or any healthcare professional. So there are delayed screenings. They're delaying their preventative care, which results in a poorer prognosis, later stage diagnoses, but they're also not asking questions about sexual health, fertility preservation, because of those perceived discriminations. And then again, with the young adult community, like you said, Tamika, there are 80,000 new young adults diagnosed every year in our country with cancer. And it, to this day, is the leading cause of disease-related death among the young adult population ages 15 to 39. So we have to get that awareness out. We have to, as healthcare professionals, get that awareness out. Now, if you're a patient falling in one of these minority populations, there are a couple of things you can do. One, fight social isolation and create your own community. Look for the people that have been through it before that can provide guidance to you. And now when I say community, that doesn't have to be your neighborhood. It doesn't have to be your local community. That can be an online Facebook group. That can be a mentoring program from a nonprofit. But the important part is getting connected and asking questions that are important to you, a woman diagnosed with cancer, a woman in long-term survivorship, so you can find resources that work for you. Second, I always recommend demystifying the cancer treatment process for yourself, writing down the questions you have for your physician, for your medical team, and bringing them to the appointments with you, so that you have that list. You're not trying to comb back and remember, oh yeah, what was that question I had 8 weeks ago, and what was it again? You have that there with you. And then also asking what to expect from each appointment. Okay, I'm meeting with my physician. What can I expect to learn from you today during this appointment? And then at the end of that appointment, assess, were your expectations met? Or are there more questions you can ask, so that you're leaving that meeting, that appointment, really confident in the next steps? And then finally, gosh, advocating for yourself. If there's a mistrust of your medical community, if you're afraid to ask questions, then they're not going to get answered, and that you are left there at that deficit. So make sure you're advocating for yourself. For example, if your physician is saying, you need some exercise, add in some exercise to fight fatigue, walk around your neighborhood, but you don't feel comfortable walking around in your neighborhood, well, your physician doesn't know that, your medical team doesn't know that. So advocate for yourself and say, hey, I don't feel comfortable. What are some other options for exercise that I can look at? There's always different options, but the most important part is being that advocate for yourself.
Thank you so much, Katie. That's such great advice. One of the things that I experienced definitely was the anxiety of hearing you have cancer. And everything else is kind of like womp, 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 like, the Charlie Brown, cartoon. But I think you're spot on when it comes to writing things down, having someone to be there for you, if at all possible, asking, if you can email in advance, just making sure that you are proactive with your health and that you are being the one that is stepping up, asking questions, or having a caregiver there to help you. I want to, because we've got so much to talk about in such a little time, and I want to say hi to everyone who's utilizing the chat. Feel free to post your questions there and we'll get to them as we can. Katie touched on this a little bit, Dr. Hecht. When we think of surgery and treatment, it can be very overwhelming. I know personally from, supporting patients and helping navigate them, I hear a lot of time that I'm terrified of treatment. I don't know if I want surgery. I just don't know. And sometimes there isn't a great follow-up once a patient is diagnosed with cancer because they are fearful. How do we help get them to the point of understanding that timing is everything and that this is just another step in the process to remove the cancer?
Yeah, I see that all the time. Patients are scared of surgery. They're scared of the treatments. And I think it's a big unknown because they don't know how they're going to do with treatments or how they're going to do with the surgery. A lot of patients, may never have had a big surgery before. And we're talking about a lot of times a big undertaking. And, like Katie mentioned, I think making sure that all of your questions get answered and making sure that you feel like you're being educated by your physician is a way that helps patients understand. I know that a lot of the physicians, myself included, that I work with, we kind of have a way that we teach. Early in my training, one of my mentors told me, do you know what it means to be a physician? And I said, well, yeah, you're taking care of sick people. And he's like, no, physician actually means that you're a teacher. So you really need to educate people, because if people are educated about the disease process and can understand why we're recommending the things that we recommend, it really does help them, I think, solidify their decisions about surgery and treatment. If we just say, well, you have breast cancer, we're going to take it out, and then the next thing is radiation. Well, if you don't explain why do you do radiation with some surgeries, or why is chemotherapy recommended with certain cancer types, it seems very scary because you don't understand the reasoning behind it. And so I think the biggest job that I feel like I have with my patients is to educate them about the disease process, and then it makes more sense as to why the recommendations are what they are.
Thank you so much. And it just shows, the compassionate care that you obviously give your patients. And thank you for that.
Mm-hmm.
Let's talk about hereditary cancers, genetic testing. Do we want to know in advance? I would say yes, now that I've had, cancer on both sides of my family. And what do we need to know? What do we need to expect? Does it matter if it's a hereditary cancer, Dr. Hecht?
Yes, That's a very good question. So I want to start off by saying, sometimes we see a lot of cancer that runs in families, and it may not necessarily be a genetic type of cancer. There's differences. A genetic cancer is one that's caused by a genetic mutation, something that you inherited from your mother or your father, and it predisposes you to certain types of cancer. There's cancers that run in families, but it may not be necessarily related to a gene. And so the American Society of Breast Surgeons actually issued a statement over the last year and a half or so that said, anyone diagnosed with breast cancer, we now offer genetic testing too. And the genetic part, where you have a gene that predisposes you to those cancers, is actually only about 5% of the population. So it's not super common. However, we've tested people that we never thought would have had a gene mutation, and we find it. And I hear it a lot about, well, do I really want to be tested? I don't know if I want to know that. And my statement is always, knowledge is power. It gives you power to know how to be better screened, or it helps us make surgical decisions. So let's say that we have a patient that's diagnosed with a gene that predisposes them to breast cancer, and they're already in the office and they have breast cancer, and maybe it's associated with other cancers. Well, it doesn't mean that they have to go and have bilateral mastectomies and a lot of drastic surgery. But if we know that they had that, it allows us to be able to follow them and screen them more appropriately. Because I'm going to watch somebody that I know is predisposed to certain cancers a lot closer. And so I think that, it gives us information to make those decisions, be it surgery or be it increased screening. And, when they started doing all of this genetic testing, insurances can't discriminate against you if you have a genetic mutation. So a lot of people ask me, well, what if I have that? Then my insurance won't take care of what, and they will. They cannot do that. They can't discriminate against you because of a genetic mutation. And so, I think that if you decide to do more drastic surgery because you find out that you're predisposed to a cancer, or if you decide, well, I just want to be followed a lot closer, it gives you that information. And then, as far as if you're whether you're male or female and you have a genetic mutation, if you have children or if you have brothers and sisters, it helps give your family information too, because a lot of the genetic mutations, let's say I had a genetic mutation and I inherited it from my mother. If I have children or my sister, they all have a chance of getting that too. And so it gives them information and can help you play a part in your children or your family members' increased screening, and helps them be more aware and educated about their potential risk of developing cancers.
Thank you. I think, we're at this point where it's wonderful that we're starting to see cancer be shown in movies and TV shows, also featured in songs. I do worry that some people will take that as this is the way that it happens. I laugh and I tell people all the time, a lot of these TV shows are some of my favorite TV shows, but that isn't always the way that it happens in real life. But I'm grateful that it's helping with getting people acclimated to a little view of what life is like with cancer patients. One of the things, Katie, I wanted to ask, for caregivers, what is the best way to have someone to find your voice, especially if you're the strong woman in your family, in your household? What's the best way to say, I need support, I need help, letting people in?
Yeah, you just did it. I mean, saying I need help, I need support, that is such a bold statement, but often it's hard to say, right? You said it best. We are used to holding up our families. We are cornerstones of our communities. But really finding that voice, not expecting people to read your mind that you need help, because in your mind, you're probably telling yourself, I can do it. I have to do it by myself. I got to pull myself up by my bootstraps. And the people around you are just chomping at the bit to support you. They want to help you. They want to support you. And if you aren't guiding them in how to love you and how to support you the way you want to be loved, then they're just guessing and inevitably missing the mark. They're probably supporting you the ways that they think that you want to be supported, and again, missing the mark. So be really proactive, be really vocal about all of the ways in which you need support, the practical ways, and just the emotional supportive ways. Hey, every Thursday I need someone to come over and walk my dog while I'm in the support group. Is that possible? And then the other way is, hey, I'm having a really bad day. I don't even want to talk about it, but what you could do is come sit with me and watch a movie.
Yeah, because sometimes it's not even about talking about the cancer or things like that. Sometimes it's just be here with me. Let's be normal outside of cancer. We have a question in the chat from Nanette. I hope I'm saying that correctly. I want to go back a little bit to genetic testing because of her question. She writes, I have a family full of cancer and have been diagnosed with my third, a rare one, EMPD. I am concerned for my daughter. Will genetic testing help future patients with treatment protocol? Also, I'd add to that, could you also talk about what type of genetic testing is offered at Texas Oncology, Dr. Hecht?
Yeah, sure. I think that, and to answer your question, if you've been diagnosed with cancer 3 times, I think it would be great to sit down with a genetic counselor to see. One of those appointments in Texas Oncology offers genetic testing. What it kind of entails is you sitting down with somebody who has been trained in genetic cancers. They take a thorough family history, and then they determine what is the best genetic test to offer to you. And so with you having had 3 cancers, was it Nanette? I think that it would be important to reach out and ask, hey, I'm interested in genetic testing. When you ask about would that help with future patients and treatment protocol, I think the more people that we test with these genetic mutations, we're finding out, okay, we didn't realize so many people had some mutations. And so we don't have a lot of good treatment protocols for some of those genetic mutations that we're finding. But what I tell patients all the time is everybody's heard of like BRCA1 and 2, the breast cancer or BRCA gene. There's a lot of media attention. It's like you're talking about TV shows. I think it was Grey's Anatomy, but I'm pretty sure somebody had that on there. And so there is a lot of publicity around that particular gene. So people understand, oh my gosh, that means I could get breast or ovarian cancer. But what they don't realize is that there are a lot of other genes that are associated with other cancers, breast cancer, colon cancer, pancreatic cancer, thyroid cancer. All of those cancers can be associated with certain genes. And the more people that we test and the more people that we find out that have these genetic mutations, it allows us to make better treatment protocols, better screening recommendations, because the more information we have, again, the more knowledge and the more we're able to make the right, I guess, recommendations for treatment and screening. So yes, it would absolutely help, especially in people with multiple cancers and rare types of cancer. I think that it would be very beneficial to you.
Thank you. I also want to thank Nicola for writing in the chat. Texas Oncology offers online support groups, and there are many women's foundations that provide online exercises for patients as well. I actually just found one, going back to Katie saying that, she shared, what if your doctor doesn't know that you don't want to walk in your neighborhood? There's some great YouTube videos that also give great cardio for beginning walking at home. I did one on Monday and it was a burner, and it was for a beginner. So it was really, really good. There are lots of ways to get in. You're walking and you're exercising, and just start where you can. Judith asked in the Q&A chat, I'm a breast cancer survivor at 60. I have a 25-year-old daughter. At what age should she get her first mammogram?
That's a good question. Usually we recommend that people start getting mammograms at age 40. A lot of people's recommendations for earlier screening depends on family history. So you mentioned that the patient was 60, I believe you said, when she was diagnosed. So it would be important to look at dad's side of the family. Does he have any early or diagnosed breast cancers? And kind of do that thorough family history. I know that now we're recommending that at age 25, people do get a risk assessment. And so that can be done by a primary care physician. It can be done obviously by a breast specialist or an imaging center. And what that entails is basically looking at family history, looking at all of the things that can predispose us to breast cancer. And then by those particular risk factors for each patient, we're able to determine if people are at an increased risk. And if they are at an increased risk for breast cancer, then we start screening sometimes earlier than we normally would. The standard answer, though, is that people need to start getting mammograms at age 40 for sure. And if they have family history of people diagnosed with earlier cancers, particularly breast, then they may need to start getting imaging sooner than that. And so that's where that kind of history and risk assessment would come in and become important.
Thank you so much. Latressa, thank you for your question. I am 45 years old. I was diagnosed when I was 25, so I totally relate to your question. She writes, 48 years old and have lost all desire for intimacy. I'm a 4-year Hodgkin's lymphoma survivor, recently prescribed testosterone by my oncologist. Will this work to bring my libido back?
Is that for me?
That's for you.
Okay. You know,
I will jump in with intimacy, but that's for you. She's asking about her prescription of testosterone.
Yeah, so a lot of hormonal changes can obviously affect libido. Um, you know, it is worth a try. There are lots of alterations in hormones that we can provide for patients, and sometimes that will help increase libido. I know it is a problem after having had treatments for cancer. Sometimes that is dramatically affected, and it's something that I don't think is a quick, oh, well, testosterone will fix that. It's different for every person. And so I would say give it a shot and see how it does. If it isn't working, then there are other hormones that we can adjust and work with, and some medications that can help with particular problems that would, help with your libido.
Thank you. I totally agree with that. And I will say it seems so daunting, Latressa, but don't give up on it. Don't give up on it at all. I can't tell you how many toys, tools, prescriptions, and things that I have tried to help out. I actually have what I call, if you've been to the Survive and Thrive symposiums where I share about this, I've got a whole treasure trove, literally a chest and a duffel bag of things that I've tried. I just got something that came in this weekend. It's called the Womanizer. It's my new favorite. Those are things when I mention these things, it's and we've shifted to intimacy if the rest of you haven't noticed what we're talking about. And feel free to message me if you want to get deeper, no pun intended, about talking about those things. But one of the things that I really do really appreciate is when we ask about intimacy, when we talk about body image, because it's a real part of it. When we talk about the scars and how emotionally that affects us. But when things don't function the same way that they used to, and we have to have a conversation with our providers. And I'm going to let you all in on something. And I'm not saying this about Dr. Heck and not all the doctors, but most of the doctors that I do talk to, I've, done talks, workshops with patients, and I've done them with doctors. And I will tell you, the doctors don't want to talk about sex either. And if you are up in age, we know that you still want to have sex. We know that you still are engaged in sex. Your doctor may, unfortunately think that you're not engaged in sexual activity, but this is where you have to find your powerful voice. This is where if you can't use your voice, write it on a piece of paper and slip it to your doctor. If you're able to email them, tell them what's going on. One of the things that has, really been heartbreaking for me is when a patient has emailed me and basically says, I've given up on the intimacy side of my life. Cancer has robbed me of my sexuality. And we all know that intimacy isn't just about the physical act of sex. It's about the way we feel about ourselves. It's about the way that we, feel when we wake up in the morning and we first look at ourselves in the mirror while we're washing our face and brushing our teeth. And cancer does play a big part on that. Nicola just, put in a great reference to the Foundation Women's Cancer / Survivors exercise together, but they also have sexuality stuff on there too. If you also are looking to find support, there are a lot of online support. Hyster Sisters, that's for women who have gone through a hysterectomy, but they help that, we're all in there sharing what medications that we've tried. We're all in there sharing different things. I know also as cancer patients, we're worried about hormones. That's why the conversation with your doctor is really important. Katie, I don't know if you want to talk to the emotional part of intimacy and maybe also body image and how it plays, because if you're so much in your head, if you're thinking like, this is not like how it used to be, if you have a partner, am I pleasing my partner? And also, if you don't have a partner, I'm going to say it. I know we're all Southern women here, but you can also please yourself. There's nothing wrong with that. And yes, live on Facebook too, I am saying that, make yourself happy and smile and get to know your body again after cancer. So when you want to figure out what works and what doesn't, you have to get to know your body again and also know that your body has been through trauma. Your body has changed. It will continue to change. So Katie, talk to us about the emotional aspects of it.
Well, I have to say, if you have not been to an in-person Survive and Thrive and gone to Tamika's session, it is like a spa day. You get champagne and strawberries and the toys, and you get Tamika, and it is just an experience in and of itself. And man, Tamika, I have sat in your sessions and just written notes the whole time, first few times I went, because it's so educational, and you were spot on. It's difficult to talk about sex because we are kind of conditioned growing up not to talk about sex, not to talk about intimacy. And then add in a cancer diagnosis, and that puts you in an even more vulnerable space. So I agree with you in that you have to communicate about it. You have to ask your providers. You have to lead those conversations because you are called to be a leader in your cancer treatment, in the side effects, in the emotional side effects. Even if you don't want to be a leader, you are called to be a leader. So really, some of my tips are just opening those communication channels in really specific ways. So when you're communicating with your medical team, Tamika, perfect, write it down. If you're uncomfortable talking to them, bring someone in there with you to help open up that conversation, like your partner. When you're talking to your partner, if you have a partner, again, that self-love is so important. But when you have a partner, opening up that communication channel in a really specific way and setting them up for success. So one, knowing what you want out of that conversation, saying, hey, I have something pretty vulnerable to talk about, or I have something to talk about with you that is difficult for me to bring up. And what I need from you is blank. And what I would like for you to stay away from is blank. So I'm bringing up a difficult conversation. I want to talk about intimacy with you. I would really love for you to just listen while I talk. And I would love for you to not try to fix it. Or, hey, I'm feeling self-conscious about my breast. Next time we have sex, can we turn the lights low and can I keep my bra on? So really knowing specifically what you want before you engage in that conversation with your partner, and then setting them up for success. Now, body image, this is a whole different topic. It includes intimacy, but it includes our day-to-day life and our quality of life. I feel so strongly about this. One of the hardest parts of my job is when I meet with a patient who I see, and they are this beautiful, resilient woman, and they are telling me, I can't look in the mirror. I don't like my breast. It gets me emotional just even talking about it now, because we can change that. You can change that. Your body is working for you before diagnosis. It's working to heal you during treatment. It's working for you long-term throughout your life, with no judgment about itself. It's a machine. The judgments about our bodies come from the thoughts that we have when we look in the mirror. So my advice is change your thoughts, right? And how do we do that? Well, first, separate yourself from your thoughts. Write everything down, every thought you have about your body, good or bad, write it down, and then go through that list with a fine-tooth comb and decipher, is this fact or is this fiction? Is this a thought? So for instance, if I say to someone who had surgery, you have scars, and you cringe and recoil, you probably have negative thoughts about your scars, because you having scars in and of itself is just a fact. You have scars. So separate yourself from those thoughts. How you do that, instead of saying, I have ugly scars, right? That could be your thought. Your fact is, I have scars. Your thought may be, these are ugly. Instead of accepting that and it becoming your belief, practice separating yourself. I have the thought that these scars are ugly. I have that thought. It's not you. It's not a belief. Your scars aren't ugly. It is your thought about them being ugly. And then step 2, start creating the relationship with your body that you want and the experience in your body that you want, right? So you're separating yourself from those scars, and then work on changing the thought that you do want to have. If you can't really bridge that gap from I have ugly scars to, well, my scars are beautiful, then I recommend finding a bridge, right? So my scars are ugly to I have scars. These are places where my body has healed. These are places of healing in my body, right? Very clinical, very, very neutral. And then move to that positive thought that you have and that positive dialogue in your body. I have places of healing on my body. I appreciate my body for healing there. I appreciate what my body has done. And then that will set you on that path to a positive body image, which will then change your relationship with your body. It will change the relationship others have with your body, your self-confidence. But again, it's just all in changing those thoughts and practicing that. You don't say once, I love the scars on my body, and then walk away like, I love these scars, they're great. You have to keep practicing just like you would practice anything else.
Yeah, that's very good, Katie. I think that that's great advice. I just wanted to jump in and kind of, piggyback on some of the stuff that you were mentioning. I think that it is so important to be able to stand up and, talk to your physician or talk to your partner. And it just kind of hearing all of this just brought to mind a story that I wanted to share. I had a patient who, we've talked about it. Sex isn't the easiest thing to talk about. And a patient came in to me, and she was a little bit older than my mom, and you don't really want to think about those things but she said, Dr. Hecht, I just wanted you to know I'm really having trouble being intimate with my husband. the problem is that everything is just dry after my chemotherapy and taking these medications that alter my hormone levels. Everything is just uncomfortable. Is there anything that we can do? And, you know, she was one of the only few patients that I've had in 6 or 7 years that I've been doing only breast cancer that has actually said something to me about it. And I was actually excited because I do have, well, here's a list of things that we can try. Let's try, you know, these vaginal lubricants. Let's try this. And what's so great is by her asking me, I was able to kind of put all of that out there. And so if you don't ask, or if you don't tell people or your physicians or your partner, then we don't know, you know. And it was really kind of a neat story, because when she had reached out to me, I had been doing a case with a plastic surgeon probably a week or two before, and she was telling me all about this new laser that she has in her office. It's called the FemTouch. And so she told me a story where she was treating a lady who was like in her mid 70s. And she said that she did like this event at her office, and they were talking about this new laser and like results. And this lady who's in her mid 70s gets up and says, I want you to know that I had not had good sex with my husband for like 15 years. And after using this laser, I'm now able to. It's not uncomfortable anymore. And so by her sharing that story with me, then I was like, I have to have some of those brochures. And then honestly, like 2 weeks later, this patient told me this story, and I was able to give her this and say, you need to try this. And so she's been and she's used it and she's gotten some results. And so that's why this all stands out to me so much, is because, you know, unless you present those things to your physician, or unless you present those things to your significant other, we don't know. And maybe, just maybe, your surgeon will have been in a case with another surgeon who has to have this really cool laser to use, you know, and it may make things so much better. So I just encourage patients to put it out there, even if it's uncomfortable. Hey, we may be uncomfortable talking to you about the treatments too, but if we have it there to offer you, our job is to try and make you better, and we want to. So don't ever be afraid to ask.
Absolutely. Communication is key on both parts. We have another question from an attendee. What other medications can be used for sex drive that are not hormones? I'm a 34-year-old ovarian cancer survivor and cannot take any hormones.
Okay, I'm sorry. She said she was a ovarian cancer survivor and could not take
34,
any hormones.
correct.
You know, it is difficult because there are some cancers where you just can't take hormone replacement. And there are some supplements, I think, that some of my patients have used that tend to help things. Again, I would just, whoever your medical oncologist is, they can look over all the cancer medications that you have been given or that they are giving you currently, and then tell you what they think will work best. I mean, there are some you know, menopausal type side effects that we are kicked into, or patients are kicked into because of their cancer treatment. And so there are other medications which may not necessarily be hormones, but that are medications that we use for something different. But one of the benefits to that medication is maybe that it helps with some of the side effects that you might be experiencing. So, you know, it would just be one of those conversations where you're very real about, look, this is what I'm experiencing. These are the symptoms that I'm having, be it hot flashes, be it vaginal dryness, be it, you know, insomnia. All of those things are things that we see when people are kind of kicked into menopause, so to speak, early because of their cancer treatment or their surgery. So I would just encourage you to have a frank discussion with your medical oncologist about, these are the things that I'm experiencing. What can we do? What can we try? Because sometimes it may be a supplement, sometimes it may be, you know, a medication which used for something altogether different, but we know that it can help with some side effects that you might be having just from your cancer treatment. So that would be my advice.
Wonderful. Thank you so much. We have someone shared that the Mona Lisa touch procedure was a life changer for me. No more painful sex, and I do not require extra lubricant. I have heard that from so many women. I keep meaning to look into it for myself. I do know at one point it wasn't covered by insurance, but people have been successful figuring out, especially if they share that they're a cancer survivor, what they've been through, seeing if the clinic that it's offering would provide discounts, or reaching out to Mona Lisa Touch directly to see if they can kind of negotiate some things for you. So one of the things that I hate in cancer experience is when money holds you back from things. That was one reason why in 2001, when I was diagnosed on the fertility side of it, I didn't harvest eggs and I did not get to freeze them because we were in a rush to get to surgery and there was not a lot of time. Things are better now, but only slightly. We've successfully worked, I'm based in Maryland, to change the law in Maryland to where adolescent young adult cancer patients have those things protected via insurance. We're working to do those in other states. If you are worried about fertility or family planning for the future, that's another thing where I implore you to also talk to your provider about. It is a lot of information while you've just been given one of the most traumatic and heaviest things that you probably will ever experience in your life. But if your doctor does not take the time to really talk about it, you have to take that breath and guide them to having that conversation. A resource for that is the Alliance for Fertility Preservation. The Alliance for Fertility Preservation, whether you or your partner needs to do fertility preservation, that is a great resource that lists so many amazing things for you. I'm happy to also answer any questions in that realm. I want to make sure that we answer any final questions before we get there. Any final thoughts from our panelists before we wrap? Anything you'd like to share?
Yeah, I think that this has been great. I would just, encourage, I think the message of this is to just be kind of your own advocate. And, it's a lot of the things that we have to talk about and that are uncomfortable to talk about. I encourage you, if you're having a problem or if there's something going on that you're not sure about, even if it's just a symptom that you're kind of, I don't know, is this something or not, reach out. It could be that because of you saying something, we diagnose something. It could be that we're able to make a symptom that you're having as a result of your cancer treatment, improve it, make your life better. So just don't be afraid to open those lines of communication with your physicians. I know that the group of physicians that I work with here at Texas Oncology, everyone wants to do as much as we can to make our patients' lives better, from treating their cancer to their survivorship, and even finding cancers earlier and screening. All of those things are so important. And if there's something that you don't think is right or something that is going on with your body, just share it with us and maybe we can do something to help.
Thank you. Katie?
I agree. That is, I agree. This is all about advocacy. This is all about finding the support you need, and knowing that, again, you are called to be the leader in your cancer care and in your life, and you may not want to be, but you are. And so find the ways that, one, you can care for yourself during treatment, two, the ways in which you feel comfortable communicating with your medical team and the people around you. And then three, really find your community, find your support, and get involved, get proactive. Those are my tips. And I am so grateful to be here today with both of you and just participate. And yes, so thank you for having me.
Thank you so much. I love talking about women's health. Until my cancer happened to me, it probably wasn't something that I would have been passionate about. But I really do appreciate you both just taking the time to be with us today. We know how busy you all are and the care that you provide for so many. We also want to thank Texas Oncology for sponsoring this webinar. We want to thank the Texas Oncology Foundation for hosting this webinar. And we talked about, Katie, you brought up the Survive and Thrive Symposiums, which you know are my favorite things to experience. Unfortunately, due to the global pandemic right now, we're not having in-person events, but we are doing this together virtually. And I get ecstatic when I see so many people join in, because you do not have to experience cancer alone. We are a community, and so we want to be here for you. I want to bring on Kelly Condon really quickly to really talk about the virtual camp that I'm excited to join you for, and help guide you through. I love being a camp director, by the way. I heard I may be getting a clipboard and a whistle, so hopefully that's in the mail. Kelly, can you tell us a little bit more about the virtual camp that Texas Oncology Foundation is hosting?
Absolutely. Yeah, first I just want to echo, thank you all three so much for being on this webinar today. It's just great partners like y'all that make us able to have these resources. So thank you all for your time and just your planning efforts as well. But like Tamika said, this year's been just crazy and hectic, and unfortunately we are not going to be able to meet in person for our Survive and Thrive Symposiums, but we are launching the first ever virtual camp experience. And so this is going to be 4 weeks full of our awesome expert speakers. They're going to be giving live presentations, followed later in the week with live Q&A, so you can send in your questions and thoughts and you can jump on live with them to talk. There's also going to be tons of workshops offered. We have everything from workout classes like piloxing. If you've never done this dance boxing, you can do this with us. Yeah. And there's yoga. There's going to be nutrition demos where you're actually going to get to cook alongside our speakers in your own kitchen. There's art therapy. There's so many other things. And then we are also getting to partner with Texas Oncology social workers to have our very own support groups within that camp. And so we're very excited. Registration is live right now. Go to survivethrivecamp.com and you can view our landing page and register for this exclusive offering. And that will also be included in follow-up emails for everyone that was registered today.
So exciting. Thank you, Kelly. So I thank you all for joining us today. I thank you to everyone. Thank you to our panelists. Thank you for our sponsors. Thank you for our hosts. And especially thank you for showing up today. Thank you to those of you who asked questions. Thank you to those of you who shared resources. Again, we are a community. I want to see you at the virtual camp. I want to see you at our webinars. And until then, stay safe, stay healthy, and continue to survive and thrive. Bye-bye.
Hi, everyone.
Bye.